Okay, so today is Christmas, and we are 1 week post-op, and I'm cold, so I'm going to put my blankie around me. Um, so yeah, it was, let's see, it is 12:31. It was about this time a week ago that I was going in for surgery. They were just, in fact, I remember exactly where I was. I was in the little staging area where they prepped me, and I think the surgery started around 1 o'clock. So, anyway, let's see. How do I feel today? I still feel sort of weak and tired. Um, I developed thrush. Probably developed it like 3 days ago, but I thought it was just a normal, like, every time I've ever been on a diet, anytime I've ever, like, sort of severely dieted, didn't eat very much food at all, I've always developed a white tongue. Isn't that lovely? And it tastes weird, it feels weird. And I knew it was something, but it always goes away once I start consuming food like normally again. Well, since it's going to be a long time until I did that, I did report it to Kaiser when they called me for a little checkup. And I told them, yeah, my tongue turned white, and they said, oh, that's thrush. So they prescribed for me nystatin. It's this oral swish. You like swish it across your tongue and then you swallow it. You're supposed to do it 4 times a day. And I don't see any improvement. I mean, we only started it yesterday, but I think it has to do more with my nutrition. You can get it for, I looked up the causes on the internet. One of them says that diabetics get it. I'm not diabetic, but I think my low blood sugar is probably what causes that with me. Anyway, so I'm going to keep taking that. My appointment it's Tuesday, so my appointment with the doctor's on Friday at 8:30. I drove my car for the second time today, just across the street to Starbucks. I know I'm not supposed to have coffee, but I'm breaking the rules. At least I got decaf, and I got a latte, iced latte. So I took all the ice out of it, make sure it was cold, took all the ice out of it, and I'm sipping it slowly. It's basically decaf espresso with milk and a Splenda to sweeten it, so there's no sugar in it. So anyway, I can't help it. I need coffee. The hardest problem that I'm having right now is trying to get all the water in, the liquids in. I know I'm dehydrated. I'm not dehydrated to the point where it's too bad, but I know that I'm not getting enough liquid in, and it's really hard to sip. I still have the painful burps. I still have right here just this feeling that, air needs to escape whenever I need to drink, and when that air does escape, it hurts. So, that's hard. I weighed 174 pounds today, which is basically what I weighed back in September. So at least I'm down to my September weight. I'm making a prediction that by Friday, I'll weigh 171. 3 more pounds, I think, by Friday. You lose weight slowly when you're not that tall or that big. If I was 350 pounds, I probably would have lost 30 pounds by now. But since I started out at 190 and actually went in for the operation, I was 185 or 86. It goes a lot slower. So, but it's still in a week's time, I've lost either 11 or 12 pounds. I can't remember what I weighed when I went in there. It was either 185. I think it was 185. So I've lost 11 pounds in a week, which is quite a bit. Anyway, I don't really have anything else to report other than the thrush. and the difficulty eating. Oh, I don't remember if I've mentioned this before. What I do to sort of thicken my broth is I add a little bit of potato flake to it, so it becomes a little bit thicker. That helps, but I'm getting tired of eating that broth with potato flakes. I need to get online and see what else there is I can do. I'm sure that I can probably move on in my diet towards other things, maybe pureed foods by now, even though I'm really technically supposed to wait till Friday to see the doctor, but most people have the second week. If you look online, the second week is where you get to pureed foods. So we'll see. Anyway, it's Christmas. I'm not hanging out with my family. It's like, I don't really care. They came by here, at different times. They've been here every day, and they dropped off a few nice presents, and I gave, my presents actually to everybody last week so that I could take care of it before surgery. So it's all good. I'm just relaxing. Oh, another little thing is, before when I had the lap band, immediately I started dreaming of food all the time, constantly dreaming of food. Well, I haven't really had that this time, but I did for the first time, not last night, but the night before. I dreamt of buttermilk biscuits. The kind that you buy in the package and in that big roll, and you stick them on it, and they're really flaky, and you can peel them off in layers. I probably have a buttermilk biscuit maybe once every 2 years at Christmas for breakfast. It's not like it's something that I've consumed regularly. I mean, seriously, the amount of buttermilk biscuits I've had in my life, it's not that many. Yet, I think what happened was I saw a commercial for them, because there's a lot of commercials on television right now for food, of course, at Christmas time. Perfect time for surgery. And that was just stuck in my head. So I could just dream of it. And I was like, oh, and I could taste it in my dream. And it was so torturous. And it made me want to go get some buttermilk biscuits, bake them, put some butter on them, just stick them on my tongue and just like try to suck something out of them. Of course, I'm not. But for some reason, that was really, really stuck in my head. I think it'll be a while before I can have bread. So yeah, the food dreams have started. Anyway, that's about it. I otherwise feel okay. Not too bad. Not like day 2, day 3. Day 2, day 3, they were hell. But I'm feeling pretty good. And I took another shower yesterday. I need one for today. And I brushed out my hair, and I didn't notice any more hair loss than I normally have, because normally, with this hair, when I brush it, it comes out, quite a bit comes out anyway, naturally. So I didn't notice anything in particular, and I'm pulling on my hair right now and just trying to see if I have any, and there's nothing yet. So I think that's due to my 2 protein shakes a day, which is really important. So even though I'm getting tired of those things, I am forcing myself to consume them. That's about it. And that's my report for my first week post-op.